The Phlebotomy Textbook, Chapter 7, Venipuncture Equipment, Part 2. In this section, we will focus on the collection tubes. Understanding the different types of tubes, what order they should be collected in, what additives are in them, and what they are used for is a critical part of being a phlebotomist. The evacuated tubes have a pre-measured amount of vacuum, which will draw in the specific amount of blood that will fill the tubes. The amount of blood collected is determined by the size of the tube, the amount of the vacuum present. When you select the appropriate size tube, you must consider the amount needed for the test, the age of the patient, the size and quality of the patient's veins, and the size of the needle you are using. The tubes used in the evacuated tube system are color-coded. The color tells you what additive or anticoagulants are in the tubes. The correct additive or anticoagulant is required for each test ordered. These are some examples of two different brands of evacuated tubes. The inside of the tube is considered sterile. They are usually plastic and silicone coated. The tube is labeled with the type of anticoagulant or additive, the draw volume, and the expiration date. The manufacturer guarantees the integrity of the anticoagulant and vacuum in the tube until the expiration date. Expired tubes may not be used during the course of blood collections in the laboratory. However, we will use them during the course, but they cannot be used for patient testing. When gathering your supplies, you should check the expiration date and tell the instructor that you are doing it. If the tubes are expired, tell the instructor during your checkoff, for example, I'm checking the expiration date, these are expired, or I'm checking the expiration date, these are not expired. During this course, we will use our expired tubes, but during the clinical rotation in the second class, you should not use expired tubes. Remember to learn the color code for the manufacturer that you are using at your place of work, as they may look slightly different. The color code is important, and you must learn it to be a good phlebotomist. An additive may help to preserve some part of the specimen, inhibit antibiotics, or help the sample clot faster. An anticoagulant stops the blood from clotting. A sample that is anticoagulated yields whole blood, and when centrifuged, will have red cells at the bottom and plasma on top. A tube that has no additive or a clot activator tube will clot. When these tubes are centrifuged, the clotted cells are at the bottom and the serum is on top. Plasma has fibrinogen in it, and serum does not have fibrinogen because it is used up in the clot. The type of sample required is dictated by the specific laboratory test that is required. The color code is important because it gives us a quick visual reference to what is in the tube. We can select the tube and keep them in order easier. It can also tell you if a tube needs more inversions or special preparations. The image on the right shows the clotting cascade. You can see in the image where the anticoagulants act to inhibit clotting. You can see that EDTA, sodium citrate, and potassium oxalate, and SPS act by binding calcium. These inhibit both the intrinsic and extrinsic pathways. The anticoagulant heparin works by inhibiting the actions of thrombin in the common pathway. These anticoagulants can only be used for specific tests. The collection tubes have a safety plastic cap over a rubber stopper, which prevents blood from splattering when you open it. The tubes must be filled to the designated volume. Volume requirements are more important in some tubes than in others. A light blue tube that is not full will always be rejected. The tube should be gently mixed by inversion. Do not shake the tubes. Do not mix blood from one tube type into another, as this will cause the lab results to be invalid and not correct. The image shows one inversion, tip over, tip back, that's one. When collecting multiple tubes, it is important that they are collected in the correct order. There is a specific predetermined order. If the tubes are collected in the incorrect order, this can result in bacterial contamination of the cultured tubes. It can also result in carryover of an additive or anticoagulant from one tube to the next. Both EDTA and heparin can cause elevation of the coagulation test PT or APTT. Therefore, the sodium citrate or light blue tube must be collected before tubes containing EDTA or heparin. The next slide reviews the type of tubes, and they are presented in the correct order of draw. Note that some slides have the same number. This means that these tubes are in the same placement in the order of draw. This red, light gray, and clear top discard tube does not have an anticoagulant or additive. This tube is used when collecting using a wing collection set so that it can remove the air in the tubing. Most locations do not use special tubes for discard tubes. They just use a duplicate of the tube they are collecting first. This yellow top tube contains sodium polyanthyl sulfonate, or SPS, and this tube requires special antiseptic skin preparation to avoid contamination from skin bacteria. Be careful, there are two types of yellow top tubes. This one is first, and the other is collected last in the order of draw. The additive binds calcium and aids microbial growth. A blood culture tube is drawn first to avoid contamination from skin bacteria or from the additives or anticoagulants in the other tubes. SPS inhibits complement phagocytes and certain antibiotics and aids in recovery of microorganisms which are found in septic patients. A patient who has a blood culture collected is usually in the emergency department or an inpatient. It is unlikely that you would collect a blood culture on an outpatient. The light blue top tube is a commonly collected tube that is used for coagulation testing. The anticoagulant in the tube is sodium citrate. It prevents clotting by binding calcium. There is a 1:9 ratio of blood to anticoagulant, and these tubes must be completely filled or the sample will be rejected, as the ratio of blood to anticoagulant will not be correct and the test results will be invalid. The BD Vacutainer glass CTAD tube contains citrate, theophylline, adenosine, and dipyridamole. Sorry about that pronunciation. To obtain a citrate plasma sample where the in vitro heparin activity has been stabilized, the CTAD tubes are used for specialized platelet studies. These tubes must be inverted 3 to 4 times to ensure they do not clot. If this sample clots, it will be rejected. This is order of draw 2. This light blue black top tube also contains sodium citrate and would be the same order of draw as the light blue tube. This tube has a gel and density gradient liquid that is used to separate the mononuclear cells from the plasma or blood. This is used for molecular diagnostic testing and is not a commonly collected tube. This is order of draw 2. This black top tube also has the anticoagulant sodium citrate and is also order of draw 2. It is used for Westergren erythrocyte sedimentation rates and has a 4:1 ratio of blood to additive. Some erythrocyte sedimentation rate tests use the purple top EDTA tube. The tube you use will be determined by the location that you work and the test that they perform. This is a red or red/gray or gold top. These are called serum separator tubes. The tube has silica as a clot activator. The sample clots, and when centrifuged, the gel will separate the serum from the red cells. If you notice the tube on the right. The tubes that are not anticoagulant will clot. This removes fibrinogen from the plasma to form the clot. When fibrinogen is removed from the plasma, it becomes serum. This is order of draw 3. This is a red top tube with a silica clot activator but no gel separator. This can be used for chemistry tests that the gel might interfere with. The clot does not form quickly and can delay testing. Therefore, many labs use an anticoagulated blood sample and plasma, as they can be centrifuged and be ready to test more quickly. This is order of draw 3. This orange top tube has the clot activator thrombin and is a rapid serum tube. It can finish clotting within 5 minutes and can then be centrifuged for stat chemistry determinations. Stat means that the test is needed very quickly. This can be used on patients who are receiving anticoagulated therapy. This is order of draw 3. This red/green top tube is a mononuclear cell preparation tube. It has the anticoagulant sodium heparin, a polyester gel, and a density gradient liquid. This tube is order of draw 4. This is a green top tube. These come in 3 different types: sodium heparin, lithium heparin, and ammonium heparin. The sodium heparin cannot be used when measuring sodium, the lithium heparin cannot be used when measuring lithium, and the ammonium heparin cannot be used when measuring ammonium. Heparin anticoagulates by inhibiting thrombin. These are primarily used for chemistry tests that require a fast turnaround time. This is the light green top that has lithium heparin and one of the commonly collected tubes. This one is a plasma separator tube and has an inert separation gel that separates the red cells from the plasma. This is well suited for potassium measurement. This is order of draw 4, just like all the heparin tubes. This is a lime green top that has lithium heparin and a mechanical barrier rather than a gel. This is used for zinc determination, which is not tested very often. Royal blue tubes have different anticoagulants depending on the manufacturer. These are used for toxicology, trace metal analysis, and nutritional analysis. When these have the anticoagulant sodium heparin, they are order of draw 4, and if they have K2 EDTA, they are order of draw 5. Collecting royal blue after green top and before EDTA tubes will ensure that you have them in the correct order of draw. Remember, EDTA tubes should not be collected before the green top tubes with heparin. The lavender or purple top tube is one of the most commonly collected tubes. This tube has the anticoagulant ethylene diamine tetraacetic acid, or EDTA. This anticoagulant works by binding calcium. These tubes are used in hematology because they maintain the cellular integrity of the red and white blood cells and inhibit platelet clumping. These are used for complete blood counts and sometimes the sedimentation rate. This is order of draw 5. The pink top tube is used in immunohematology, which is known as blood banking. It may have special labeling requirements when it is collected, since it is used for blood typing and cross-matching. The pink is a commonly collected tube type. The white stoppered tube is a plasma separator tube and is used for molecular diagnostics. Both of these tubes have EDTA and are order of draw 5. The tan top tube might be used for healthy 1-year-olds or children when monitoring for lead poisoning. This tube also contains EDTA and is order of draw 5. This is not a tube that you will use as often as the other EDTA tubes. This is the gray top tube and it has 2 additives. The anticoagulant is potassium oxalate that works by binding calcium, and the antiglycolytic is sodium fluoride. The antiglycolytic prevents the cells from using the glucose in the plasma. So this tube is suitable for glucose monitoring, lactic acid, and blood alcohol levels. This is order of draw 6. This is the second yellow top tube. It contains acid citrate dextrose, known as ACD. This is used for cellular studies in blood bank and immunology, such as HLA testing. The anticoagulant binds calcium and preserves red blood cells. This is order of draw 7. Be careful that you don't accidentally grab a urine tube. Notice the pointed end on the yellow top. The gray tube states it is for urine. This slide and the next one show you which tests can be affected by contamination from carryover from the tube being collected in the wrong order, and worst, contamination can occur when a person collects in one tube and pours over it into another tube. EDTA can affect many chemistry tests and is not appropriate for chemistry analysis. Depending on what is in with the heparin, it can affect the test. Both anticoagulants are not appropriate for coagulation studies. The light blue is used for coagulation studies and must always be collected before EDTA or heparin tubes. This slide lists additional tests that will be wrong if there is contamination of EDTA or heparin into other tubes. This is a long list and illustrates the importance of collecting tubes in the proper order. If EDTA gets into a blue top tube, then the coagulation studies would be prolonged due to calcium binding. This would make it look like the person would not be able to clot properly or would bleed too much, when in their body this is not true. If a serum sample is required for testing, heparin would cause invalid results. A sterile sample would always be first to be collected to avoid getting bacteria from equipment, your skin, or the patient's skin into the bottle. A blood culture only wants the blood to be in there from the patient to avoid false positive tests for septicemia. The order of draw recommended by the Clinical Laboratory Standards Institute is blood cultures, SPS or culture bottles, light blue, sodium citrate, red/gray or gold, red, orange, red, royal blue, clot activator. Next, green or light green, royal blue heparin. Next, lavender, pink, white, royal blue, tan, EDTA tubes. Next, gray, sodium fluoride, potassium oxalate tubes. Next, yellow ACD tubes. The additive or anticoagulant is what determines the order of draw. If two tubes have the same additive, they can be collected one after the other. A syringe is good for smaller veins. This is because it allows for the manual control of the suction pressure. The barrel can hold from 2 to 20 milliliters, and the needle used with the syringe is called a hypodermic needle. When selecting a syringe for use, you should use one that holds more than what you need, but the one that is closest to the amount you need. A syringe hypodermic needle must have a safety shield, and you should activate it with the table or hard surface. It will be 21 to 23 gauge and 1 to 1.5 inches in length. A transfer device allows you to safely transfer blood from the syringe into the tube. The needle is activated, removed from the syringe, and placed in the sharps container. Next, the transfer device is connected to the syringe. The syringe should be up and the transfer device down to keep any air at the top. And the tubes add the tubes into the transfer device in the order of draw. Allow the vacuum in the tubes to pull the blood into it. Never press on the plunger, as this will hemolyze the sample and ruin it. As I stated in the previous slide, syringe order of draw transfer to a tube is the same as the evacuated tube system recommended by the Clinical Laboratory Standards Institute. A winged blood collection sets, also known as butterflies, are used for very small veins. They have a gauge from 21 to 23, a length of 0.5 to 7.5 inches for the needle, are attached via a flexible tubing to either a syringe or an evacuated tube system holder. A discard tube is used with the evacuated tube system to draw in the air before collecting your tubes. You must account for this air in the tubing when deciding what size syringe you need based on the volume needed for testing. A tourniquet is a non-latex band used to impede venous but not arterial blood flow. In the clinical site, these are used and are disposable. A blood pressure cuff may be used in some cases, like blood donors donating blood for transfusion. The tourniquet is used to make the vein more prominent and easier to find. There are vein locating devices that might be helpful in locating non-visible veins. They use high-intensity LED. We do not use them in the course. They are not commonly used in the clinical lab setting. Gloves are mandated by OSHA's bloodborne pathogen regulations. The gloves we use are non-sterile and need to properly fit, powder-free, and non-latex. If latex gloves are used for any type of procedure, you must ask the patient if they are allergic to latex. Most hospitals do not allow latex in the building due to the risk of anaphylactic reaction. The puncture site must be cleaned with an antiseptic. The antiseptic used for routine venipuncture is 70% isopropyl alcohol, which is bacteriostatic. When blood cultures or donor blood units, you must use iodine or chlorhexidine gluconate. If using iodine, you must ask the patient if they are allergic to the iodine. Never use iodine on someone who is allergic. The procedure will offer an alternative. Chlorhexidine is now used more often than iodine. Puncture site protections supplies. You will need a 2x2-inch gauze pad. After a needle is removed, the gauze pad is used to apply pressure to the venipuncture site to stop the bleeding. Ask the patient to hold pressure while you label the tubes if you are in an outpatient setting and the patient is capable. If an inpatient is too weak, hold pressure till the bleeding stops, then secure the bandage or wrap. If band-aids are used, they should be non-latex, but don't use these on older people who have thin skin or people who react to adhesive. There is a non-latex self-adhering bandage wrap, which might be called Coban or Coflex, depending on the manufacturer. Instruct patients to leave it on for at least 15 minutes before removing it. Patients on blood thinners may need to wear it longer. You may need a plastic bag labeled biohazard, a test tube rack, alcohol-based hand sanitizer, a labeling pen, or label printer. To ensure the quality of the equipment, always ensure that it has intact packaging when you use it. Make sure the needle cap has not been opened. Inspect your needle for defects before using. The inspection is done right before the needle is inserted. When we do a check-off, you have to tell us that you are checking for expiration dates or checking the needle for defects, as this is the only way that we can know that you are doing it. If a tube is out of date, you may not get a full draw. It may have no vacuum or the anticoagulant may not work. The specimen won't be preserved or the gel barrier will not work. In class, we may use some expired tubes because we are not testing the samples, but in the clinical site, you should not do this. Thank you for listening. This concludes the Chapter 7 lecture.